Where you going with all those snacks?
Hi guys, my name is Fatema, or the Healthy Chemist. I work in a hospital as a pharmacist, and today I bring to you guys a two-part episode on diabetes and its signs and symptoms. Diabetes is a condition where there's increased sugar levels in your blood above normal. Now this happens because as we consume carbohydrates, they break down into sugar. Our body has an organ called the pancreas which increases or secretes insulin into the bloodstream, and that helps store glucose into fat cells, muscle and tissue, and the body uses this glucose for energy. Now there are two types of diabetes. Type 1 is autoimmune, and that just basically means that you can develop it at birth or at a young age and the body just does not produce insulin. Now there's type 2 diabetes that you develop later on in life due to lifestyle factors and diet and a lack of exercise. Eventually the body becomes resistant to insulin, and so glucose is not stored readily into the cells. Now the normal range of glucose in our body should be about 4 to 5 millimoles per litre when we're fasted, and about 8 millimoles after we've eaten. Now in diabetics this can be slightly increased. Now let's talk about risk factors for developing diabetes. Now diet is the number one risk factor. So if you're having a diet that's high in saturated fats, sugar, alcohol, you are at more risk of developing diabetes. Obesity is also a risk factor, especially in the abdominal area. If you live a very sedentary lifestyle or you have a lack of exercise in your normal routine, if you are Black African, African Caribbean, or of South Asian descent and over 25 years old, then you are 2 to 4 times more likely to develop diabetes. If you have high blood pressure, this can increase your risk of diabetes. Gestational diabetes can develop when you're pregnant, so it's really important for you to control your sugar levels, control your diet, and exercise regularly to prevent this from happening. If you have a family history of diabetes, you are 4 to 6 times more likely to develop diabetes. Smoking not only increases your risk of diabetes, but also increases your risk of heart and lung conditions. There is a condition called polycystic ovary syndrome, otherwise known as PCOS, and this increases your risk of developing diabetes because your body causes an imbalance of hormones, which includes insulin. Polydysbia is excessive thirst, and this happens because there's an increased amount of glucose in your body. The kidneys have to work harder to excrete this glucose, and it ends up going into the urine, which then pulls fluid out of the tissue and into your urine. Now diabetes can also cause polyuria, which is increased urination, and this links back to our first point where you have fluid pulled from the tissue into your urine, and that makes you need to pee more. Polyphagia is increased appetite, and this happens to diabetics because glucose isn't being stored into the cells of the body, and the body needs glucose for energy. So that is why diabetics end up feeling more hungry. Diabetics are at a more risk of recurrent yeast infections because the increased glucose in the body helps the candida, which is the fungal infection, and this can proliferate around broken skin. If you have diabetes, it can lead to a lot of complications, and these include neuropathy. Neuropathy occurs because the increased amount of glucose ends up damaging your blood vessels. This means that there's less blood supply going to the extremities of your body. This means you can suffer from tingling in your fingers and your toes, and because of the lack of blood circulation to these areas, your healing ability slows down. So if you have a cut in your foot or your fingers, blood might not reach those areas for your skin to heal. Diabetics can also develop retinopathy, which causes the blood vessels in your eyes to burst. This means that the blood vessels can leak fluid or blood, and it can cause blurry vision, and you are at more risk of developing eye conditions such as glaucoma. Nephropathy is also another complication, and this is when you end up with chronic kidney disease, and this happens because your kidneys usually filter blood, but the excess in glucose ends up ruining this filter, and then proteins will start to go through instead. This can also increase your blood pressure. So be sure to get your health checks done at your local pharmacy. If you notice any warning signs or symptoms, please speak to your GP. Hope this video was useful for you guys. If it was, please give it a thumbs up. In the next video, we'll be discussing how to prevent diabetes and what to do if you or someone you know has diabetes. So please make sure you subscribe to the channel so you're the first to know when the video comes out. Thank you guys for watching, and I'll see you again next week.